According to the British Association of Aesthetic Plastic Surgeons, more than 5,000 people underwent a surgical rhinoplasty in 2013. Well, for those of you not quite brave enough to face the scalpel, I've come along to one clinic to find out what the possible alternatives could be.
Before we do the first model, let me show you some of my previous work. This is a gentleman, 22-year-old, never liked his nose, got a big hook here, large dorsum and a droopy tip. In dimensions it is bigger, but overall to fit his face it looks like a straight, nice nose, and he was dead chuffed. This is the patient who had surgical rhinoplasty before, and unfortunately the surgeon removed too much of the bony framework of the nose. She came to see me. She does not want to go through surgery again, and by injecting safe derma filler I corrected the deformity, then it would look straight and natural, and she was very happy with that. Holly, what I'm going to do now, I'm going to inject some of that safe hyaluronic acid between the skin and the bone in a certain layer. Just one simple injection, you wouldn't feel it, and that will correct and reshape the top of your nose. Okay? Very good. Yeah. That was the first bit dealt with. It took about 5 seconds. So that little bit of a depression there, it's being corrected already. And then I'm going to work on the tip of your nose. Have a look at the mirror and see what you think.
Wow, what a difference. That's brilliant.
I'm really happy with the results. I think that it's amazing. I'm really happy with it. It wasn't painful at all, just a little pinprick. I'm so delighted. I'd definitely do it again.
But it's not just women seeking non-surgical nose jobs. It's become extremely popular now also with men. I'm talking to Chris here, who's going to explain to us why he opted for a non-surgical nose job.
Well, my story was that I had a car accident and I had reconstruction surgery done on my nose. I wasn't particularly satisfied with what had happened with the reconstruction. I found Mr. Labib, and the results were fantastic.
That's fantastic. Now, looking back on your 2 operations and obviously deciding the 3rd time to opt through the non-surgical route, would you have done those operations or would you have just gone straight to non-surgical now?
Probably straight to non-surgical now, I think.
So, Mr. Labib, tell us, why is the nose such a focal point of dissatisfaction for so many people?
Antonia, the nose is the most focal, prominent feature of the face. By correcting the nose, it adds more balance, more symmetry, and it gives you more confidence and happiness overall.
Great, so that will explain why nearly 5,000 rhinoplasties were carried out by BARP surgeons last year. So talk to us a bit more about surgical options. What happens during a rhinoplasty?
It's a routine procedure where patients will come in on the day, have general anesthesia for an hour, have the nose corrected, stay with us overnight and go home the next morning.
Great, but the scalpel, unfortunately, isn't something that everybody likes. So for those scalpel phobics like me, what would you suggest?
Do you know what? We have an alternative now. There's an option now of the 15 minutes nose job.
So talk to us, how does a 15-minute nose job work?
It's very simple. Consultation, explaining the procedure. I put a bit of numbing cream on the nose in certain areas, and then I inject temporary safe derma fillers between the skin and the bone and the skin and the cartilage, and it will last up to 2 years, and the results are instantaneous.
Well, it sounds like an ideal solution, but who is it good for and who is it not good for?
50% of my patients have had surgery already, but they're dissatisfied with the results, and they don't want to go back to have another surgery with the cost involved, the downtime, and being in hospital. And they come to me and say, I don't want to go back to surgery again. I haven't got the funds or the means to do it again. Can you just basically make it neater and just make it smoother for me? And they just have the non-surgical procedure.
Well, finally, Mr. Labib, is this the future of the perfect looking nose?
This is definitely an alternative. And I'm excited about it because more and more people coming in to have a 15 minutes nose job, which is very, very effective, very safe, and it lasts up to 2 years.
If I could change anything, I'd change my nose.
If I was going to change anything about myself, I'd change my nose because I broke it when I was younger playing football.
It is horrible. Men who have plastic surgery, no way. To be honest, I'm actually quite happy with myself, so it probably wouldn't change too much.
If needles aren't quite for you, we guarantee our next feature won't have you turning your nose up. We're talking to a top beauty editor who's going to be talking through some of the leading anti-aging treatments.
If you're not quite ready for a facelift but would like to have some amazing results that no facial can ever get, I would highly recommend Pellevé. This is radio frequency skin tightening that works by heating up the skin to about 40 degrees, contracting the collagen, causing the fibroblasts to make new collagen and elastin, and it just tightens the face. It's great if you have sagging jaws or your eyes look a bit tired and you want to open them up. Some people even like it in the décolleté area. They say it even lifts the bust a little bit. And if you're wearing a strapless dress for a big event, this really is the wow factor A-list treatment. The brilliant thing about it is that there's no downtime either. You can go back to your office, you can go to the gym, and no one will know that you've had a procedure. You just have this amazing glow and you just look so much fresher. Pellevé is available nationwide. Hair removal, a painful subject for many people, but with the new Vectors hair removal system, a treatment that used to take 40 minutes now only takes 4 minutes. Great for people who are on the go, it really takes the ouch out of hair removal. Hot off the press, let me introduce you to Energed, a revolutionary new treatment that delivers hyaluronic acid under the skin without any needles. It's fantastic for people who have got acne scarring or stretch marks, and it works to really even out and retexturize the skin. After about 3 treatments, people really notice a difference. Energed is available at the Phi Clinic on Harley Street in London.
I think if people that have cosmetic surgery, then it's their own choice.
If they feel like they want to change something about themselves, who's to stop them?
Like, I don't know, I might get my lips a bit more bigger, maybe? Anything like the massive lips, I don't think is that attractive.
We're just going to look at a lip base colour and just see what sort of colour really sort of suits her. I think that's quite a natural colour for you. How do you make sure and ensure that you're getting the best treatment and the best technician and the best result on your face? Firstly, I would have a look at your technician's training credentials. Have they been trained within the EU? All the countries around the world have different standards when it comes to equipment, training and pigments that go in the skin. Within the UK, our equipment's inspected by the HSE and our pigments are actually approved in line with EU regulations. So have a look at where their training and the pigments and their products are actually sourced from. What we want to achieve with Holly's lips is something just really natural. She's got a really good shape there anyway. So at the moment I'm just looking at colour to really emphasise that beautiful sort of like youthful lips that she's got. Experience speaks volumes. It's only over time that their actual style, their understanding of skin tones, how colour changes in the skin really comes to light. It will always look quite dark when it's first done, and that's because when the colour goes into the skin it oxidises a little bit. So when the colour goes into the skin it oxidises a little bit, which makes it look a little bit darker. It will generally be darker for about 3 to 5 days, and then what will happen, it will soften and it will lighten. So the area will lightly exfoliate, it will soften and lighten, and it will look quite light till about week 3, week 4, and that's when you see all the colour then come back through. They will feel quite dry afterwards, so I give you a healing balm to put on 2 to 3 times a day, just for about a week. Secondly, ensure that they have valid UK insurance. It means that you are protected should something happen that's not the norm. So for instance, if you had an allergic reaction, if the pigment was placed poorly, or something happened that you wasn't happy with, it means that you can actually address that and make a claim if needed. And the other thing is, if you do suffer from cold sores, it's always advisable to use a cold sore application cream probably about 3 days before and 3 days afterwards, just to minimise the outbreak really. All treatments within the UK need to be carried out in licensed premises. This means the local authority will go in and inspect the clinic to ensure they meet all their guidelines in connection with cleanliness, clinical waste, hygiene and infection control. Normally a technician would have attended a course in infection control and understanding bloodborne viruses. All the needles are totally disposable and sterile. You will feel a little bit of pain over the Cupid's bow area. It is quite sharp, but apart from that, the rest of the procedure should be quite bearable, not too uncomfortable for you. Is that okay? What do you think to that?
Oh, that's lovely, lovely
Yeah.
colour.
Good, good. I think it suits you. I think that'll feel really nice and natural. And finally, although we've touched on the experience, it's no good using 10-year-old technology and techniques. Make sure your technician keeps up to date what's happening in the industry. They should be attending seminars, regular training, and they might even have a portfolio of learning where they can show you how they've kept up to date with continuous professional development.
The decision to undergo any cosmetic surgery procedure or aesthetic treatment is one that you should always make with great reflection and research. We hope our TV show has been of some help to you. Remember that research is key to a successful and safe outcome.